Now next we have the main man who is heading up this Health Research Board Trials Methodology Research Network, Professor Declan Devane, who's Health Research Board funded now and a academic in the Department of Nursing, isn't it, in UCG. And had a little bit of interaction with him around this programme and hope to have a little bit more now on the way up. So I'm really very much looking forward to an overview of it again to get my head around what the
Thank you, Michael.
what it's about.
Thanks, Michael. My throat isn't great, so forgive me. What I want to do is just to give you a flavour of where the Health Research Board Trials Methodology Research Network fits into this jigsaw of clinical research support that Graham Love spoke about this morning, and how it fits in with what Fionnuala will be speaking to you later on about the Irish Clinical Trials Research Network. So the context which many of you know of, many of you are involved in, we have recognised limited number of clinical trials and other intervention studies involving human beings carried out in Ireland, relative to other European countries and relative to our size. The engagement of clinicians and other healthcare professionals in research is still relatively limited, and there is a relative lack of capacity to undertake clinical trials. There is certainly much more capacity, and I'll come on to that because the environment is very much changing. There is a recognition by the Health Research Board and indeed other funders that addressing methodological and statistical support needs of the health research community is necessary if we're to become leaders in our specific areas. And again, this speaks to the national infrastructure, this jigsaw, this matrix that's needed to support the clinical community in doing that and the research community in doing that. But some of the context needs to be all seen. The potential we have is fantastic. To date, 15.5% of the previous rounds of EU funding, the FP7, came to Ireland. And 15% of the funding coming to Ireland was awarded to 4 clinical trials, many of them in Joe's institution, all of which were coordinated by Irish clinicians. So we do have some large, multi-site, significant randomised controlled trials pulling out in substantial funding into the island. We're the second largest exporter of medicinal products in Europe after Germany. 8 of the world's 10 largest medical device companies are located in Ireland, most of them in Galway. We have the 5 university-based clinical research facilities, clinical research centres, and really importantly, with the development of the Irish Clinical Trials Research Network, which Fionnuala will speak with you about later, and which the directors of the relevant clinical research facilities and clinical research centres are involved in. And that gives the research community a structure which to approach to seek advice for the conduct of the trials, support in the conduct of the trials, design and conduct, etc., all the way through to analysis and reporting. So why is trials methodology important? I suppose this is where my particular interest lies. Trials need to become more efficient and effective if they lead to efficient and effective healthcare. You've heard all morning the importance of SOPs and protocols, all aimed at providing a robust answer to the clinical question you're asking. And all we're asking is, why don't we apply the same robust methods to answering questions around how we conduct our trials, how we analyse our trials, how we report our trials, or how we otherwise disseminate them to clinicians, patients and policymakers. So we know, for example, that approximately 50% of randomised controlled trials that are funded will not achieve recruitment target, or will only do so with substantial extension to the recruitment dates. Yet how many randomised trials have been done evaluating the different recruitment strategies that the research community have implemented to improve that recruitment? Many of you in the audience here have had problems with recruitment trials, and myself included, but we're not very good at actually implementing formal evaluative processes of the things we do to improve recruitment. For example, what impact does principal investigator visiting the site actually have on recruitment? Does make a difference. And it's about applying those techniques. So if I give you another example, a recent paper published in the British Medical Journal in my field in maternity care, they looked at interventions for the prevention of preterm birth, which is a large driver of mortality, morbidity and healthcare cost. And of the 102 randomised trials that were reviewed, there were 72 different primary outcome measures reported in the same sphere of preterm birth. So when it comes to doing meta-analysis or pooling that information together, it's virtually impossible. So a lot of good money, good staff time, patient participation is being wasted or could be utilised better. So the right trials need to be chosen, implemented and reported in the right ways. So for example, there's a team in the UK now who are developing a core outcome set that must be reported or should be reported in the conduct of all studies that evaluate the effects of interventions for the prevention of preterm birth. Meaning that down the road in 10 years' time, when these trials come together, we've got a technique of actually pooling that information. I imagine that many of you here have struggled or have lots of conversations around what is our primary outcome measure. Then the other conversations around what is our secondary outcome measures. So we're trying to look at is core outcome sets as one part of this network's work going forward. We have uncertainties in many areas. So uncertainties, if you think the research process in terms of what questions are prioritised, well, the questions we ask is, what's the best way of prioritising research questions? How are patients recruited? We ask the methods questions, what methods have been evaluated or should be evaluated to recruit patients, or to recruit sites, to recruit clinicians, etc. So what we're looking to do is apply the same rigour that you apply to your research questions to the methodology of how you conduct your work. And it's quite surprising how little work is going on in that space. So this is where the TMRN comes in, with the team here. The aim of the TMRN, which will expand to include more institutions, is to strengthen trial methodology and reporting of trials on the island of Ireland through a programme of work which we hope will impact internationally. We've got substantial expertise in the network and expertise in people conducting trials in their own particular fields. And we also have quite substantial international collaborators. We're focusing on three main streams within our trials methodology research network. Number one is support. So looking at providing a trial methodology and reporting advisory service. And this is not to replace, but to complement the advice that's currently given to you all by our clinical research facilities and clinical research centres. But for example, we sometimes come stuck with particular questions that require perhaps a more broad methodological thinking, like sample size estimation in your stepped wedged cluster design. Stepped wedge designs, indeed in a community setting, these can be quite challenging. So what the Trials Methodology Research Network is aiming, the advisory service is trying to do, is trying to put a mechanism in place where people can go to seek this methodological advice either in Ireland or linking up with the Medical Research Council trials methodology hubs in the UK. The idea being twofold. The question gets answered and that expertise gets brought back into the country. The second part of our support is we're establishing a database of clinical trial expertise on the island of Ireland. I certainly know, having been told of some trials that were conducted in my own institution, that I didn't know particular individuals were interested in that particular space at all. And that was my own institution, so I'm very conscious, if that's the case, then it's likely that there's many other individuals around the country who aren't collaborating with other individuals or identified to each other. The training education, we have a whole series of activities which will become more and more definitive as we move on and will go up on our website. This is the first educational meeting we've had. I'm glad it's been, in my mind, a success. We'll be running summer schools on clinical trial methodology, short courses on introduction to clinical trials. Note for the diary here, the next event, a meeting that we're definitely having, is on the 17th of April in NUI Galway. We're having a one-day education meeting on introduction to clinical trials, open to a wide audience. We have PhD studentships. We currently have 2 PhD students working in the area of trial methodology, Caroline in UCC and Aisling in Galway, and we have a PhD student starting in Trinity and also starting in UCD in the coming months, looking again at the area of trial methodology. And lastly, we're looking at research and innovation. So this is the conduct of trial methodology research. So some examples of that, how, I'll talk to this in a moment, how we might be able to help would be, we have, for example, in the clinical trial network grants that have gone out or have been awarded recently, we've embedded some trial methodology work in those grants. Development of core outcome data sets. Development of what we're calling SWOTs, studies within a trial. So if you're conducting a trial, you're concerned about recruitment, why not embed an evaluation of 2 different recruitment strategies within your study? It's usually relatively cost efficient. It adds value to your bid. You're answering 2 clinical questions. So it's quite attractive to reviewers, and it doesn't drain massive resources. So why is it relevant to you and the people who are conducting trials or involved in the trial space? Again, embedding of trial methodology within trials, consider that. Whether it's through the HRB-TMRN or not, in your trials, consider, are the methodological questions that can be embedded here to answer some of the concerns we know we're going to face as we go on. Remote site monitoring, we heard people talking about this morning. Skype versus on-site visiting. We assume one may be better than the other. Can we apply the same rigour in terms of, for example, doing a trial on that? The TMRN, we hope, and that does certainly seem to be the case at the moment, it's certainly beginning to provide the infrastructure to provide methodological thinking within the network. It's not for a second to say that I or my colleagues have all the answers. Far from it. We lack the expertise that we need on the island of Ireland overall. But we do have good networks with our international partners. And the expertise in Ireland, there is lots of pockets of expertise that we don't know about. So maybe we can act as the interface for that. Later, we hope that the work of the TMRN will help in the design phase of trials by improving the methods and how they're conducted. The programme of training courses will complement the work that the clinical research facilities and clinical research centres are providing. All of the education activities are highly likely to be run in partnership with the relevant and various clinical research centres and facilities and the individuals therein. The Trial Methodology and Reporting Service will, certainly within 12 months, be off the ground and being used by the research community. And that doesn't mean you have to wait for that time. If you have got questions, we will try to help. And the database of trial expertise. Again, lots of people conducting trials, perhaps in your topic area, or perhaps the methods or the particular trial design that you are particularly interested in, or perhaps both. And this database will provide a single point of access for that information. So that's it about the Trial Methodology Network. A couple of sales pitches here. I became a Twitter, is that what you call them? Twitter person last week, thanks to Sandra. So she's been on her phone, she's not texting people, she's twittering all day. That's our handle there. So Graham Love has already been commenting on us this morning. And hashtag Trial Methodology. This is our Facebook page. The Cochrane UK and Ireland Symposium is a very interesting event that's happening in Dublin this year. It's held in Dublin or the UK. Back in Dublin this year, 23rd and 24th of April. We're quite heavily involved in that, have a stand there also, and we're hosting it in partnership with the Cochrane Centre. It's well worth a visit for those who are interested in trial methodology and then in the synthesis of those trials through the systematic reviews that Cochrane Collaboration hold. Please fill in your evaluation forms and leave them at the desk outside the door as you go forward. We want to learn from these events, see what you found good, what we can improve on. And lastly, 17th of April, Introduction to Clinical Trials, Galway. Thank you.
I think Declan's voice might just stand up to 1 or 2 questions. There's some water there.
Thank you.
Yeah.
Thanks, Mike.
Anything for Declan? Okay, if not, thank you very much.
Thank you very much.
And,
Thank you.
we'll move on.